Hi, everyone. I'm Steve Adubato. Welcome to an important, compelling conversation dealing with the question of navigating the healthcare system for people with autism. We're honored to have a distinguished panel. We kick off with Dr. Suzanne Buchanan, Executive Director of Autism New Jersey, and Michele Adubato, who happens to be my sister, but that is not her most significant title. She's the Chief Executive Officer of the Northward Center and the founder of the Center for Autism. And finally, Dr. Oana Baroody, Departmental-Behavioral Pediatrician at Hackensack, Meridian Health, and underwriter of our healthcare program. I want to thank all of you for joining us. Michele, let me start off with you on this. You founded the Center for Autism, and the website will be up. Everyone's website will be up. You founded the Center for Autism, and I happen to know this not just professionally, but personally, but you have a deep and abiding commitment to helping people dealing with autism and their families. Talk about it.
Well, the issue that we're talking about today is, once again, another inequity for people with autism and other disabilities. So the reason why I founded the Center for Autism, especially in our urban area, is because of the inequities, like healthcare.
And Suzanne, I don't want to assume that people know exactly how autism is defined and make sense of it. We assume that all the time, but we're incorrect. Define it, please.
Sure. So autism is a developmental disability in which people's social skills and their communication are impaired in some way. Many individuals with autism also have intellectual disability, which makes it very difficult for them to learn new things. So they have a slower rate of learning. And there's, a number of other challenges that go along in terms of adaptive behavior and kind of making it through everyday activities that can make life particularly challenging and are particularly challenging in the healthcare setting, especially.
You're going to see the helpline up. It's 800-4-AUTISM. You're going to see that helpline. And Suzanne, help everyone understand, if you call that helpline, what's happening on the other end.
Mm-hmm. So you're going to speak with one of my three colleagues, one of whom is an attorney, one of whom is a social worker, and one of whom is a very seasoned parent. And the three of them each bring their own areas of expertise to figure out, well, first of all, to listen, and then with the caller, figure out what they need in a most comprehensive sense. So we try to connect people to the information they need, the referrals they need, and the practical and emotional next steps.
Thank you. And Dr. Baroody, let's talk about this. Autism affects young people in a variety of ways, impacts young people in a variety of ways. Make it clear what those challenges are from a healthcare perspective, and then we'll talk about accessing and getting the help they need. Please, Doctor.
Yeah, so as Suzanne mentioned, so autism is a developmental disorder where children and individuals have difficulties with social interaction and communication. So that plays a role in a healthcare setting, right? Because so much of what doctors do is get information from the patient. Where does it hurt? How does it hurt? What does it feel like? Which again can be difficult for kids who have autism. The other part of the diagnosis of autism is these repetitive behaviors, sensory sensitivities, rigid behaviors. So some of our kids may be more affected. A lot of the healthcare settings, right? There's a lot of stimuli, especially if you're thinking about going to the emergency room or things like that. But even sort of in a regular doctor's office, right? There's a little different smells, and you're supposed to wear this gown that opens in the back, and all these funny things that are very uncomfortable for many of us as well, but very difficult for children and individuals with autism.
Michele, as you're listening to Dr. Baroody, again, you not only founded the Center for Autism, but this is near and dear to not just your head, but your heart. Talk about it from a family and personal perspective, because you understand it on that level as well.
Well, absolutely. My 5-year-old grandson, Sebastian, has been diagnosed with autism. I'm going to fake like I'm drinking this coffee. Sebastian drew this for me. So awesome. We can't figure out how to get him blood work. Okay. A very common problem for people with autism. He cannot go to a quest. He can't do it. And, Suzanne and I've talked, we are supposedly the experts in the field, and I'm sitting there trying to figure out how do I get my grandson access to blood work that he needs because he has an eating disorder, because he's not eating properly. And we want to make, so it's completely obviously linked to health. On the other end of it, from a broader spectrum, like we look at the pandemic. The pandemic brought out certain things from a healthcare system of how unknowingly, by the way, the healthcare system is failing our children with autism and adults with autism. They don't know that, but they need to know that. They're not doing that on purpose. And what we have had to do, and I know Suzanne has done this also, is we brought together our group. They have to go in a place where they're trusted, where they feel safe, where we spoke with the parents, and we were able to, get, our clients and many other people vaccinated, people with autism, for the number one reason: they trusted us. That's nothing to do with the vaccine, because we've done other things. They've trusted us, and trusting is very important for people with autism.
So, Suzanne, I mean, that's Michele, who is an expert in the field. She understands it from a variety of perspectives. She has certain relationships and contacts to navigate the system. And she's talking about the struggles that she has had and their family, her family and Sebastian's family have had. So what does that mean for folks who don't have that expertise, who don't have those relationships? How much more challenging is it for them, A, Suzanne, and B, why are we not mandating some significant degree of training for healthcare professionals in this regard? I know it's a loaded question, Suzanne, please.
It is. We have to make sure, like Michele said, that the people who don't know about the needs of people with autism know. And it's not just the physicians and the nurses and the people interacting like in the doctor's office. It's also leadership of healthcare systems, right? And so we need more protocols, and they need more experience working directly with these families in a proactive way, right? Michele talked about trust, right? And trust is huge. Trust is based on experience. Trust is based on knowing that the healthcare setting you're going to, whether it's for a COVID vaccination or routine care or specialty care, that they can meet you where you are and handle your needs, whether it's sensory sensitivities or problem behavior or difficulty communicating where it hurts, right? Many times parents report to us that they actually forego routine and even sometimes specialized care because it's so traumatic. And so it's not just, well, of course, we need more training, for doctors and nurses and everyone involved in the healthcare interaction, but we need more infrastructure and leadership support to develop more, protocols and structures in place so that there's a larger healthcare workforce that's informed about the needs of people with autism.
But Dr. Baroody, let me ask you this. To what degree are you helping your colleagues in the healthcare system understand what they need to understand to provide the best quality healthcare to children dealing with autism and, as Michele said, their respective families?
So the way we've seen this over time, it's that, it's sort of a multi-pronged issue, right? Part of the issue, and early on in my training and when I started seeing patients, I would so often hear stories where families just would avoid, right? The dentist would come up, or certain things, or blood work would come up, as Michele mentioned. And most families would say, well, Johnny just can't do that, so we just don't do that. And early on in my training, I said, oh, okay, Johnny just can't do that, and we had so many other things to talk about that, we sort of went to the next topic. But that's really not the way to address it, right? So I think, it's multifold, right? So we have to address parent education and really kind of moving forward from, avoiding, right? And kind of, coming up with some strategies of things that we can do. We've developed a coping passport. So it's a small little tool that families can bring
What's
with
it called
them.
again? A what, Doctor, again? A coping
passport. Yeah, so it's like a little document that parents can bring with them. It talks about, the things that soothe them, what triggers them when they're in a medical setting. How do they communicate? And oftentimes, because parents are under stress too when they are there to, to the ER or getting blood work.
So are grandparents, right, Michele? Finish your point, doctor. I'll come back to you, Michele. Go ahead.
Yeah, and it's hard for them to think of those things on the spot. So thinking about it ahead of time can be really helpful. For us as the medical providers, again, there's a lot that we've done. We've tried to, encourage training. We're actually in the process of hiring a behaviorist. Hackensack Meridian Health has been, very open to our needs and, has done fundraising. And now we have a behaviorist that will be hired, that will be full-time and will be helping kids in a medical setting. The other thing that we also do, and I just want to touch on this, is sometimes.
Go ahead.
Well, so this is like a little prescription that we'll give to patients. So it says, I went to see the doctor today. I got through it, but some things were really hard for me. Can you help me with? And things like, take my blood pressure or get on a scale. So if we are seeing a child that is having a difficulty getting their blood pressure taken, and we try and whatnot, and we still can't do it, we'll give this little note, because oftentimes the child has a team, a school team, maybe they have a team at home, and these are things that can be practiced. So obviously the blood work or the dentist or those kinds of things may not be perfect, but it's something we can work on.
Michele, as you listen to the doctor, let me ask you this, because you understand this on such a professional and personal level, what advice do you have for parents right now? There are a significant number, I've got to believe, statistics, I always try to remember, statistics are really about people. They're not numbers, they're about people. Michele, for the many, many families and caregivers who are watching right now, trying to navigate the healthcare system, what advice would you have for them right now, Michele?
Well, that's the right word, how to navigate. And unfortunately, again, it's put on parents. And I do want to say something about what the doctor just said, and I heard you, and it makes a lot of sense. I think that you have to be a superhuman being to be a parent of a child with autism. And you know what? That shouldn't be. It shouldn't be. This is a systemic issue. This is a systemic issue that our society needs to deal with, and we need to stop putting it on parents only. Parent do this, grandparent do that. And I get it, because we're living it and we advocated it for 30 years and now I'm living it. And I have to tell you, it's, again, you think you don't know until you have that child or that grandchild with autism. And the point of that is we need to change, as we have done, Suzanne, many times. We need to change the system.
In the meantime, what advice do you have for parents, though?
The advice for parents, of course, is to never give up. The advice for parents is to continue to look like we're doing. Many times, parents, as you said, parents just go, look, they can't do it.
They throw their hands up.
We can make it easier. We can make it easier if our healthcare system and our systems understand the difficulties and the stigma of what our adults go through. I just want to say really one quick story of the Center for Autism. We had this young lady, 33 years old. She became weak. We didn't know what was wrong. The mother didn't understand. She collapsed. And we insisted, and of course we helped the mother, we insisted that she get a full medical review before she said, and she found out that she had cancer. She never went to a gynecologist ever. She was 35 years old. Never. Mother never even thought of it. Because you're dealing with so many other things that, and what you said is like goes down on the totem pole, and then all of a sudden it becomes number one. So I guess the advice I would give to parents is health matters, and proactive health matters. And then that's where our systems need to help us get there.
And they're not mutually exclusive, Suzanne. As Michele said, it shouldn't be either exclusively or almost all on parents. We need to make some real changes, but in the meantime, whatever that means, parents have to, and Michele just very effectively said gave some real advice to parents, but Suzanne, I want to come back to in the time we have left. Mm-hmm. Your work at Autism New Jersey, trying to influence and impact the system, as Michele said, on the state and federal level, real quick, please talk about that.
Right. Sure. So we realized from our own COVID vaccination efforts that the critical ingredient was the medical behavioral collaboration along with the family. We talked with families We understood their child's needs, whether it was a child or an adult, right? And we talked with the nurse who was assigned to that child. And so we made sure that every possible predictable and even sometimes unpredictable events were taken care of. And that's the level of time and attention and collaboration that's needed system-wide. And it only happens in teeny tiny pockets. And so we have what we call an advancing healthcare initiative. We've hired a behavior analyst to lead it. And we've been talking all year long with Hackensack Meridian and other healthcare partners across the state so that we can bring people together on a statewide level. We're not at the level of government in terms of needing legislation or regulation yet, because we know that within healthcare systems, there are intelligent, educated, motivated, compassionate people who just don't have the extra time in the day to plan for the needs of people with autism. So that's what we want to bring some coordination and leadership to in collaboration with healthcare partners throughout the state.
To Suzanne, Michele, Dr. Baroody, cannot thank you enough. And Michele, you pushed us to do this. It's the right thing to do. We have a responsibility to shed a light, to provide more information that's credible and substantive, and be involved in the effort to help so many parents that are overwhelmed and grandparents dealing with issues of autism with the people they love in their lives. So thank all of you very much. You've done an important public service. Thank you very much.
Thank you.
Thank you.
Stay with us. We'll be right back after this.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by PSEG Foundation, Kane University, Delta Dental of New Jersey, PSC&G, the Fidelco Group, Rutgers University, Newark, New Jersey Sharing Network, Robert Wood Johnson Foundation, and by the New Jersey Education Association. Promotional support provided by Meadowlands Chamber and by NJ Biz.
PSE&G is building the utility of the future. A future where people use less energy, and it's cleaner, safer, and delivered more reliably than ever. We are modernizing to lower emissions, support more renewables and electric vehicles, and reduce outages. And we are empowering our customers. At PSE&G, we are powering progress.